Welcome to Healing Horizons. I am Chris Daniels, your host, and today we are tackling a practical question: how to choose the right Ibogaine treatment center in Mexico for alcohol addiction. This is a safety-first guide designed to help you evaluate clinics with confidence, ask the right questions, and avoid preventable risks. Nothing you hear today is medical advice. Ibogaine is not approved to treat alcohol use disorder, and it can be dangerous without careful screening and medical supervision. Always consult a licensed clinician who knows your history before you travel or commit funds. My goal is to combine evidence, ethics, and real-world experience so you can make informed choices, protect your health, and give recovery the best possible chance. Thanks for listening. Let us start with why people consider Ibogaine for alcohol addiction. Ibogaine and its metabolite noribogaine appear to modulate multiple systems, including glutamate and GABA balance, serotonin and dopamine signaling, and neurotrophic pathways linked to learning and habit change. Many people report rapid reduction in cravings and a window of psychological openness that supports deeper, therapeutic work. There are case series and observational reports suggesting benefit for alcohol, but high-quality randomized trials are limited and outcomes vary widely. Ibogaine is not a cure by itself. Think of it as a catalyst that can interrupt entrenched patterns while you build new supports. The potential is real, but so are the risks, which is why choosing a medically robust program matters. Proceed carefully and skeptically always. Safety first. Ibogaine can prolong the QT interval on the heart's electrical system, which raises the risk of dangerous arrhythmias. It can also stress the liver, trigger psychiatric destabilization in vulnerable people, and interact with many common medications. Most serious incidents reported worldwide stem from poor screening, electrolyte disturbances, hidden heart disease, or lack of continuous monitoring and emergency response. A safe program prioritizes stabilization before the dosing day and cautious observation after. Expect clear protocols, conservative decisions, and transparency about complications. If a center minimizes risks or promises guaranteed safety, walk away. The right team will tell you exactly how they reduce risk and what they do when something goes wrong, because preparation saves lives. Your health is the top priority every single time. In Mexico, Ibogaine is not an approved medicine, and there is no government certification specific to Ibogaine treatment. However, clinics that provide medical services must operate under health regulations enforced by COFEPRIS, the National Sanitary Authority. You can and should verify that the facility has an active operating notice and sanitary license, that physicians hold valid professional identification numbers, and that any claimed specialties are recognized. Ask for copies in advance and confirm numbers through official registries. Reputable programs are transparent about their legal status, their scope of practice, and the hospital they use for escalations. Be cautious of centers that advertise government approval of Ibogaine itself, or that refuse to share documents. Oversight exists, even if it is imperfect. Verify contracts in writing too. Next, evaluate staffing. Ask who the medical director is, what their training includes, and how often they are physically on site. A safer model includes an experienced physician available around the clock during screening, detox, dosing, and the acute recovery window. Nursing should be present at the bedside with advanced cardiac life support certification, not just basic first aid. Small patient groups allow closer monitoring. A common target is no more than 2 or 3 guests per nurse during dosing. Clarify who interprets electrocardiograms, who adjusts electrolytes, and who decides to delay or cancel a session. High-quality centers make conservative calls and document them. Competence should be visible in calm routines, clear communication, and respectful boundaries. Ask about training, supervision, and turnover of staff. Comprehensive screening protects you. Before acceptance, you should complete a thorough medical history, a physical exam, and medication review. Objective testing should include a 12-lead ECG with documented QTC, electrolytes with magnesium and potassium, liver enzymes and bilirubin, kidney function, a complete blood count, and pregnancy testing when appropriate. Depending on age and risk, a cardiac consultation or echocardiogram may be indicated. Mental health assessment should screen for psychosis, bipolar mania, suicidality, and trauma needs, and confirm capacity to consent. If laboratory abnormalities are found, the clinic should correct them and recheck before proceeding. Finally, you should receive clear written instructions about medication tapers, diet, hydration, and sleep in the weeks leading up to treatment. Clarify how results are reviewed and documented before dosing. Alcohol withdrawal can be life-threatening. A competent center will never give Ibogaine to someone in active withdrawal. Instead, they will stabilize first using evidence-based detox protocols. That means assessment with a standard scale, timely benzodiazepines, thiamine before glucose to prevent Wernicke issues, fluids, electrolytes, and close observation for seizures or delirium tremens. Complicated cases may require phenobarbital or hospital management. Only after vital signs, electrolytes, and mental status are stable should Ibogaine be considered. Ask how long they wait between the last drink and the dosing day, and how they handle rebound symptoms afterward. Clarify whether a physician writes the detox orders and whether you can complete detox at a partner hospital if needed. Safety during detox predicts safety during Ibogaine as well. Medication interactions are a major reason to slow down. Ibogaine can increase QTc and affect drug metabolism. High-risk combinations include methadone, many antipsychotics, tricyclic antidepressants, some selective serotonin reuptake inhibitors, and other drugs that prolong QTc. Lithium, bupropion, and tramadol can raise seizure risk. MAO inhibitors are contraindicated. Some antibiotics and antiemetics, like certain macrolides, fluoroquinolones, and ondansetron, also prolong QTc. A careful taper or substitution plan may be required, supervised by your own prescriber. Contraindications include structural heart disease, significant arrhythmia, prolonged baseline QTc, severe liver disease, uncontrolled hypertension, active psychosis, untreated bipolar mania, pregnancy, and severe renal impairment. Ask the clinic for a written list of contraindications and a pharmacist-reviewed interaction report. Do not stop medications without medical guidance at home. Ask about the dosing and monitoring protocol. Ibogaine hydrochloride offers more predictable dosing than total alkaloid extracts, though both are used. Safe programs use weight-based dosing, start with a test dose, and titrate only if monitoring remains stable. Continuous cardiac telemetry, pulse oximetry, and frequent blood pressure checks should be standard, with intravenous access in place. Electrolytes are optimized before dosing, and magnesium and potassium are repleted proactively. Lights are low, stimulation is limited, and staff remain at the bedside throughout the acute phase. You should understand exactly how long you will stay, commonly 7 to 10 days, including screening, stabilization, dosing, and early integration, with flexibility to extend if medical or psychological needs arise. Ask who can halt dosing at any time safely. Emergency readiness is non-negotiable. A truly prepared clinic maintains a stocked crash cart with a defibrillator, oxygen, airway equipment, suction, bag valve mask, intravenous fluids, antiarrhythmics like magnesium sulfate, benzodiazepines for seizures, and protocols for torsades and advanced life support. Staff drill regularly, document incidents, and review them for quality improvement. There should be a written plan for ambulance transfer, an identified receiving hospital nearby, and a bilingual physician who can hand off care. Ask how many escalations they have handled in the last year and what they learned. You want humility, not bravado. If equipment is dusty, expired, or hidden, leave. If there is no physician present during dosing, leave. Your safety depends on readiness. Transparency and practice under pressure matter a lot. Ask where their Ibogaine comes from and how purity is verified. Reputable centers can provide certificates of analysis from independent labs that confirm identity, potency, and the absence of heavy metals and contaminants. Dosing scales are calibrated and logs are auditable. Next, look at outcomes and transparency. Do they publish aggregated data, including complications, or at least share case volumes and mortality reporting procedures? Honest programs discuss both successes and setbacks. Seek verified testimonials and opportunities to speak with alumni, not only hand-picked stars. Visit if you can. Evaluate cleanliness, privacy, language support, and whether the group size and gender mix feel right for you. Trauma-informed, respectful care should be obvious from the first call. Your impressions in person are valuable and predictive. Time to wrap. Today, we covered safety, staffing, screening, dosing, monitoring, and how to vet clinics. Plan for integration and aftercare through therapy, relapse prevention, peer support, work, and coordination with clinicians at home. Ethical programs use informed consent, avoid guarantees, and offer respectful BUIDI-informed elements. Discuss travel timing, medical clearance, and support person options. Red flags include minimal screening, no continuous monitoring, vague protocols, secrecy about sourcing, and pressure tactics. If Ibogaine is not suitable, consider supervised alcohol detox, medications like naltrexone or acamprosate, and evidence-based psychotherapy. Key questions: licensure, staffing, screening, dosing, monitoring, emergency plans, aftercare, costs. 2 wins. 1 delayed for lab correction and stayed sober. Another used alumni and family coaching. I am Chris Daniels. Thanks for listening today.